Ladies and gentlemen, friends, good morning and welcome to our second ObeFit webinar. Now, this is part of the RAC biggest weight losers challenge that has registered more than 10,000 participants. Our participants come in the physical category where they actually weigh themselves, and in order to accommodate individuals from around the Emirate, we have a virtual program in which you may take your weight from any clinic close to your home, and we accept it as an recorded weight. At any rate, the RAC biggest weight loser challenge . Am I muted?
No, sir, it's fine. Go ahead.
Okay, I was muted for a while and therefore I stopped in my welcome. Nevertheless, my welcome is warm and welcome to our second ObeFit webinar, where we will be talking about the medical management of obesity. And in order to address this subject, we have none other than our own director. We have none other than our own director of medical services in the RAC hospital, and that is Dr. Shweta. Now, friends, when I was reviewing information about obesity last evening in preparation for today's program, I noticed that we had mentioned in our brochure that 40% of adults in UAE, and that includes children, were obese or overweight. Now, I compared that to the global standard, and the global standard for obesity and overweight worldwide is 39%. We have a lower ratio in children at 13% and a much higher ratio in our children in the UAE at 40%. And when I looked around to see which was the most obese, which is beyond being overweight, obese, when I looked at which was the most obese country in the world, it was the United States at 37% obesity in the population, and Japan at 5% was the slimmest country to which we will all aspire. I also noticed when I was researching the correlation between obesity and ailments, and I noted down
Professor, you're muted. 1 minute. Well, you're muted.
Yes, sir. You are muted. Please unmute yourself.
yeah.
Fine, sir.
As I was saying, I noticed that every single ailment had a correlation with obesity in one way or the other. But friends, I am no expert on the subject. Our expert on the screen in front of you is Dr. Shweta. Now, Dr. Shweta is an exciting speaker. She speaks at TEDx also. She has done her medical studies, her DNB neurology, an MD in medicine, an FACP from the United States, and a management degree from Cambridge in the United Kingdom. She has worked in several countries, and that includes Africa, specifically again, South Africa, Canada, the Middle East, and of course, in her own home country, India. She has more than 40 scientific publications to her name, including several chapters in several books. But beyond education and beyond her career, she is a champion, a state champion in table tennis. She is a qualified musician. She is an avid traveler across 30 countries. And most interestingly, she is a spiritual seeker. And she has done her studies and spent time with the world famous Dr. Brian Weiss, the past life therapist. Dr. Shweta has more than 200 workshops to her name, and we can tag this one on as 201, and much more, of course. Ladies and gentlemen, my great pleasure to present to you Dr. Shweta, our Director of Medical Services, who will talk about the medical aspects of obesity. Dr. Shweta.
Thank you, Professor, for this very warm introduction, and welcome everybody. Happy 2022. I think there cannot be a better day other than today, the very first day of the year, to talk about such an important topic. I think we have a very good sort of the thing that we will be targeting obesity, particularly this year with our commitment at Rock Hospital. So thank you for all of you who have been kind enough to register. I think 10,000 is a very good number, Professor. And let's hope that we have at least some outcome in relation to the reduction of obesity. I myself have struggled quite a bit. I gain weight and I lose and I gain. Last year was a little bit better off. I could lose about 10 kilos, but yes, it's a never-ending journey of obesity. Today, my job here, 20 minutes, is to give overview about what are the medical complications and issues arising out of obesity. I think a very interesting observation which I did as I traveled was I went to a country in Vietnam. Every single person whom I met there was super slim. And Professor talked about Japan, but it's interesting to note how once you enter into a country, you understand their eating habits, their lifestyles, and how that relates to their physical presence. So they were absolutely slim. Everybody is working. There's no sedentary life out there. So I think everything goes back to the lifestyle as well. So 40% is indeed a lot when it comes to weight.
Just to interrupt, your slides are not visible.
Sure. Yes, I will share them again. Just let me know when it's visible. Yeah. So anyways, I was not talking anything related to the slides, so that's perfectly fine. Is it visible now?
Yes, ma'am. Perfect.
Thank you. So essentially, we were talking that it's all related to the lifestyle that we have as people in this country. So first of all, welcome everybody. Let's talk for about 20 minutes about the medical issues in obesity. We will talk about its prevalence, the complications arising out of it, what could be the potential complications of treating the obesity. I will talk about some surgical complications, medical complications, and then what really happens in obesity. I think in my press conference, I had talked that if I come here with all the red blotches all over my body, if you see me like this, you will be worried. I'm sure that you will wonder what is happening to me. And that is exactly what happens inside the body. Obesity is nothing but inflammation. Inflammation, which means essentially the red, whatever we see outside, is exactly what is happening within the cells inside. It is this long-standing, repeated inflammation, which is the reason for all the medical complications that we see in obesity. Now, Professor did talk about it, but I think overall, if we talk at the world's adult population, about 13%, this is a slightly old data. I'm sure there's a little more percentage over the time, and possibly it will be a little more after the pandemic, considering all the people working from home, the sedentary lifestyles, the hybrid working patterns, the lack of exercises, all that would be contributing towards more and more numbers about the prevalence. And essentially, if you look at time from 1975 until 2016, the data from WHO, it's almost tripled. And this trend will be continued if we don't do something about it. And we don't have to do it just for the cosmetic reasons, because yes, cosmetically, obesity is bad. It looks terrible. You can't fit in your clothes and you have to restore your wardrobe, but also very, very important in terms of the impact or the bad effects what it can have. Now, what really is obesity? Okay, first of all, we have to understand that there are some crude measures of noting down in your hospital or in the clinic, or even if you have a little meter at home. The BMI index is a very, very crude and rough measure. So what you do is you just take your weight and you take your height, and then there is a number automatically which can be derived from the height and the weight, which is connected to a standard. And anything about 30 kilo per meter square is essentially classified as obesity. There is also overweight. And then there is a normal weight compared to your age and the height and the weight that you have. But there are many, many sophisticated other means to determine how to decide obesity. It's not also just the number, it is the shape which matters. So some people have a very central obesity structure, which means their paunch is very big, and then there is a sort of an hourglass pattern. So there are many, many shapes. There is also something like a cylinder pattern. The pattern, again, I will repeat myself, the pattern is directly responsible for all the complications that we see, particularly the central pattern, or also known as apple obesity. It is the real reason behind all the problems that we have. It's not that, yes, any of the numbers above 30 is good, but relatively speaking, it is the shape also which counts. So all of you who have been participating and who are part of this discussion, do measure your inches also. So do a dedicated survey of where exactly is your fat stored the most, which is directly responsible for all the complications. Now, this was a very, very revealing figure. You know, this is the beauty when you have to talk about something you learn the most. So I thank Professor and Rock Hospital for giving me this opportunity. This was the shocking figure which came in 2015-16, 525,000 admissions. This is the data from NHS in UK, admissions which are related to obesity. Now, until now, we just understood, okay, cosmetic reasons. Okay, you still have a few problems like blood pressure. We all know it can lead to diabetes. These are the generic understanding that we have. But admissions, this is something which means we have to take it up very, very seriously. In a year, if your 525,000 odd admissions are happening, this is of serious concern, and that is what we will be talking today. So where exactly, what can obesity do? Just an indicative figure that this apple shaped or the pear shaped, or there are so many synonyms for it, but essentially central obesity, or you will come across a terminology called metabolic syndrome, which is the reason for most of the complications. If we divide the complications, we can simply have all the medical complications, brain-related complications, or brain and mind. I am a neurologist, so somehow special attention and focus goes to it. And I do see in my clinical practice people coming with memory issues, with depression, with anxiety, who have obesity as their breeding ground. Of course, other factors play, genetic factors, etc. and stuff. In fact, today morning, I was reading an article which suggested that just 10 minutes of a walk, okay, this is so important, that just 10 minutes of the walk has enough chemicals which are produced like BDNF and serotonin and basically all the happy chemicals in the brain, that you can beat the depression instantly by 40 to 50%. Your mood can have a major shift, just 10 minutes of the walking. And that is the reason why all adopting the healthy lifestyle is indeed towards the avoidance of all the complications arising out of the obesity. And then obviously I will spare some time talking about the treatment related obesity, because people, everything in today's world, unfortunately, is centered around 2 minutes delivery. So McDonald's and pizzas, and then you have everything which is very fast. The gratification is immediate, but in obesity, trying to do anything which is sudden, trying to go for any shortcut can land in complications, which I'll be talking about a bit in when it comes to treatment related complications. So this is just a rough overview of what can be the potential complications. We will go step by step because we have to understand essentially from head to toe. If we don't understand that what a lot of people would come to us and say that, oh, so you think my gallbladder problem is also coming from the obesity? Oh, I have problems related to the liver. Is it also coming from the obesity? Look, obesity is like an under denominator for most of the problems that we face. So all this underlying inflammation that I talked about, finally, where is the fat stored? It's coming in the liver. Finally, what is happening inside your pancreas? Finally, what is happening inside your other organs, in your heart, in your arteries, particularly in your blood vessels, is that all this fat is getting accumulated. So directly or indirectly, obesity is a lot of contributory factors towards a lot of diseases that you see up here. Now, list is essentially very long, but to simplify, I'm not going to go by the list, but to simplify, I want to highlight a few problems. Now, one of the major problems is related to arteries. So thickening or sort of lipid deposition or cholesterol deposition in the arteries. Now that can happen in the heart, it can happen in the kidney, it can happen in the brain, or it can happen anywhere, wherever you have arteries. And what can that cause? Heart attacks. What can that cause? Stroke or paralysis. What other things you can happen? Renal failure or kidney failure. The other place where the fat sort of deposits and causes a havoc is also joints. I'm sure there is a talk which is, I think the last session is Dr. John is going to speak about the effect on the joint. Finally, your joints are carrying so much weight. I see in my clinical practice today at least 5 patients with spondylosis, with back issues. Why is all that? Why does the lumbar spondylosis happen so commonly? A, sitting. B, so much of weight to carry. Your spine has a certain limitations of the weight that it can carry. And then diabetes. We all know diabetes. The root cause of diabetes, beyond the lifestyle, it's essentially the metabolic syndrome, particularly above the age of 30. So there are 2 types of diabetes, type 1, which happens in the younger population. There is also something called type 1.5. And then there is type 2 diabetes. So when it's related to obesity, metabolic syndrome, it's essentially the type 2 diabetes. Cancers. Now, this is a very revealing even factor for me, that most of the cancers have some or other base related to excess of estrogen, which is related to essentially the problem which is linked to excess of fat in the body. So when we talk of cancers as, yes, the wireless devices, and then we talk of the toxins, and then we talk of the genetics, we often forget obesity. So simply highlighting it as at least awareness is necessary when we are contemplating that we have to target obesity as a treatment. Now, strokes, paralytic strokes. Yes, we see pretty often paralytic strokes, particularly in UAE. If I talk about the age, is quite different from what we see in the Western countries, particularly the age here at which we see paralysis, or also called jalta in Arabic, is around from 40 to 55, which is much younger than 65 to 80, what the Western standards say. So it is again very important that we are aware about the potential complications. In this list long, I will highlight one of the problems, which is also related to infertility, the woman's health. Obesity is responsible for all the alterations of the hormones, and it is responsible for people suffering from infertility. Also, a lot of people come back to me with an ultrasound saying that there is fat deposit in the liver, and that is what we call as non-alcoholic fatty liver, or NASH, in short NASH. So NASH is also a part of the obesity. Now, people who have a very big tummy and stomach, when they lie down, obviously your esophagus or your food pipe is going to be pushed up, and that pushing up will cause something called as GERD, or gastrointestinal reflux disease, acidity. All this is very common. I already talked about the low back pain and this, and very important, the skin issues, the non-healing stuff which you can see, which is happening, what you have. I mean, let's not go about the names, but very important to understand that all the non-healing problems of the skin are also linked to obesity. I'm going to talk about this one particular problem because I think awareness in this area is very important. A lot of people come to me in my clinic and say, I don't sleep well. When I get up, I'm not fresh. I have a problem maintaining my awareness when I'm talking to people. I'm driving, I can fall back to sleep in seconds. Now, mind well, all these are complications. Potentially, you have to ask yourself, of a problem due to excessive snoring in the night, which is also called as obstructive sleep apnea. What essentially happens is that if you have a double chin, or if you are obese, if you have a central pattern of obesity, you essentially have snoring, or the oxygen going to your brain is reduced, which essentially leads you to being less fresh in terms of the sleep. We need a few hours of sleep where you can restore yourself. Sleep is called the nature's nurse. So if we don't have enough number of hours where the body is rejuvenating and chemicals being produced, obviously you feel a lot of problems getting up. OSA is not uncommon in this country, okay? The sleep apnea across the globe. If you see, this is the map of United States of America, 1 in 12 people roughly suffer from this problem, and it is no different even here. So if we go by that number, imagine the number of the people. If I raise a poll here out of 35 people that we have on this chat, and to all the people who are viewing from their own live stream at their own places, ask yourself this question. A, are you centrally obese? B, are you not refreshed when you get up in the morning? C, do you snore a lot? I'm sure your partner would be talking to you about that. And D, it's high time that you do something about it, because simply fixing that portion can get your blood pressure sorted, your sugar sorted, your life, so to speak, sorted. So this is very, very important for us to talk. Now, what really is happening? See, we saw a plethora of problems linked to obesity. The whole list is just unending. But what is really happening in terms of simple physiology? Because unless we understand the basics of it, we will never change. We have to know from the fundamental, okay? It's not that complicated. I always believe that aware, care, and dare. If you really are aware about what is happening, you care about it, and then you dare to do something different, you can achieve your goals in obesity as well. So if you look at my figure here, what is really happening is in the center, there is this bad obesity, or the upper body, what we talk, or the problem related obesity, or the problem related fat. What it is doing is it's releasing a lot of free fatty acid, and pancreas secretes insulin. Insulin is the one which brings your glucose down. And what happens is here, the pancreas cannot perform. It's all inflammatory process. And there you go, your insulin is down, which can cause problem. Or once the insulin is secreted, your muscles cannot take it, because finally insulin's job is to convert the glycogen into glucose, which does at also the level of the muscle. That cannot happen. And again, that is what can cause problem. In your vasculature, which means your blood vessels, it causes more constriction. You don't want constriction, because that means the blood won't flow, oxygen won't go, and that means your organ can be damaged. So it's like a link which starts all the way from these bad fats, or the free fatty acid which causes. So you might have heard loose terms like insulin resistance, decreased insulin clearance. That is essentially all the responsible factor for the problems. Now, excess fat could be related to genetics, could be related to environment. I always like to call it as an analogy. In my family, for example, and this applies, and this analogy is so true even in my own family, everybody is above 100 kilos. So I am already having a loaded gun in terms of the genes which I am carrying from my family. But if I press the trigger, and that trigger is lifestyle, that trigger, which means I don't walk, I don't take healthy food, I don't take care of my weight, I don't adhere to the restrictions, etc. and stuff. I'm just pressing the trigger, and all the loaded bullets are enough to sort of have an impact in my life. So genetics and environment. Now, it's not just the lifestyle, it's also the surrounding environment that we see. And that's why all the people who are listening to me here, please make sure that you don't showcase that to your children. The childhood obesity is nothing but the mirroring phenomenon of looking at the adults, munching, watching television. You don't even know when you're working, and you don't know what kind of food that you're eating. You're eating without awareness. The half of the times, half of the times, and could be more, it's not that you're satieting your body by eating the food, it's just the satiety of the mind. Essentially, it's all in here as part of the behavior complex, which you have to treat when it comes to treating the obesity. I'm sure most of you would agree, but if you are actively participating, if you agree to me, please put down the number 1 in the chat, and then number 2 if you don't agree. I always like this interactive stuff, but some setups it's not possible, but it'll be good to have, if you agree that this is what we are doing to our children and we should start adopting the lifestyle so that they look up to us and then they don't do the same. I've had a boy just a few days back in my clinic who had a seizure or a fit after playing 36 hours of video game. I mean, this is scary, right? As a doctor, as a community person, I feel, what are we doing to our next generation? So it is our moral obligation to understand all the factors and not to allow them to mirror this. Now, cancer, I was also looking into why and how is cancer related to the obesity. So this is also important because 11% cancer in women and 7% in men are directly related to the potential complications of obesity. Basically, if you look at, again, the figure here, it's all the central obesity. It's triggering that bad inflammation. It is asking the pancreas to produce more insulin. There's a lot of stress. Whenever there is a stress to organ, either it reduces to produce a substance or it increases. And then there is extra cells which are also making estrogen, and too much of estrogen is not doing nothing but allowing the cells to multiply. Cancer is nothing but multiplication of the cells when not required. Science says all of us have regenerated cells. So our skins regenerate once in 7 years. Most of the cells, we undergo a change, you know, it's sort of a regenerative process every 7 years, that the cycle of the body that we have. But what happens in cancer is it's proliferated, it's unstopped, it's unchecked, and it just goes on to produce all the bad effects of the cancer. So excess body fat increases your colorectal, which means your stomach and your intestine, esophageal, the food pipe, kidney, pancreas, breast cancers, endometrium, which is your uterine cancers. All of it can be increased by obesity. Last 5 minutes, I will be talking about complications of treatment, and then we will open the floor for discussion. Obesity is a direct correlation and result of inactivity and poor choices. I believe life is all about choices. From the morning we get up to snoozing the alarm, to drinking the coffee versus tea, to coming to the office or taking off, life is only about choices. So it's only and only related to what we are doing. Remember the trigger analogy that we just discussed. So it's only about right or wrong choices that we ourselves have to take. In terms of treatment, as I told prior, there is no shortcut. And in fact, there can never be a shortcut because body is essentially very complex. Trying to fix obesity with a single pill, and that is what the world is talking about. By the way, this is the 3 days back news where the weight loss medication Wegovy or semaglutide has taken off the shelves. It's like not available. It's short in supply. Everybody wants it. This is despite all the controversies, the FDA approval, so many things are happening. If you just type in this particular injection, semaglutide, there's a lot of action happening on Google right now with this medication. There are no shortcuts. So it is indicated only and only if your doctor prescribes, and your doctor has to go through a lot of list of the medications which the person can be given. If you are at risk for diabetes, if you have high blood pressure, which is not controlled, if you are having a particular typical metabolic syndrome or the central type of obesity, and if you have other factors which are at risk, for example, you had a heart attack, you had a stroke, you're coming out from it, that is when it is indicated. Otherwise, it's not something which is indicated. Now, what happens is people just want to, again, take the route of the surgery, or what is, so there are 3 fundamental types of the surgeries which can be done for obesity. Surgery is good for certain indications, okay? If you have a weight which is more than 150 kilos, you're suffering from a lot of problems, there is no doubt that surgery can lead you to the next level. But just for the cosmetic point of view, just for the sake of cutting short the whole thing, surgery is not something which is good. So the 3 types of surgery are, one is you just cut the stomach and then sort of join it. So you reduce the capacity of the stomach, 1. 2 is you just put a balloon, which will also reduce essentially the capacity, or you do a special sort of a bypass again, idea is you're reducing the capacity of the stomach. Now, there are many new techniques also, endoscopy, which means you don't have to go through a cut process. You just have an endoscope place and then which can be done. But end of the day, The point to remember is it's not complication free. People have developed blood pressure issues. People have developed neuropathy or the affection of the nerves. They feel a lot of giddiness and dizziness, which happens. There is something called dumping syndrome. They feel dizzy, and food which is eaten is not going to the making essentially the glucose that you need. So many other things can be a part of the complication. However, you have to speak to your doctor. Obesity is not something which you should just try and test it and then, you know, and I would admit I did that. Being a medical professional, I never went to a professional and seek the right help. And that is what you guys should not do if you are really intending to fight this problem of obesity. Once you understand that this is why this particular tablet is given, or this is the reason why you should avoid a particular injection, this is what you should not do, these are the types of activities, that is when you can make a difference. And that is also the purpose of Rock Hospital's campaign, to bring all of us together with the experts and discuss what is right for you. So I think there are only 3 things which are right for us. And with this, I will be ending my talk. The 3 things which are right for us is eating healthy, walking or activity. So having a standing desk, having a step-up desk, you know, doing any kind of activity, at least ensuring that 10,000 steps are through, and then hydrating yourself. I think water is so important, and it is an essential component also to tackle the obesity. So I would end here, Professor, thanking all the team for this wonderful, wonderful efforts. So again, the message is being aware, care, and dare. Let's make a difference to contribute to reducing the prevalence, and particularly also for the childhood obesity for this country and world at large. Thank you very much for a patient hearing. Thank you.
Thank you. Thank you, Dr. Shweta. It's we who must thank you, and especially our audience. We have a high ratio of obesity in the UAE, and in this particular instance, RAC Hospital has registered 10,000 participants, several of whom are listening in. You have an absolute target audience who are listening in to your very educative lectures. There are so many things we have picked up from here. Well, one is that obesity is not just a situation, it is a disease, it is an ailment. When you talk about it, you have given us a long list of ailments that you've highlighted. You spoke about the correlation of obesity with cancer. You highlighted the diabetes syndrome and the correlation. I mean, joints, almost everything, including sleep apnea. And certainly that was very, very educative. You also pointed out the remedies. You spoke about the medical or the medication that a doctor would perhaps provide. You suggested that surgery had its merits if it was medically required. And of course, you ended with a topic close to my heart, which was that lifestyle is supportive in all aspects in reducing body weight. Thank you so much for that. Dr. Wilku, if we have any questions for Dr. Shweta before she runs away for her other duties, it would be so nice to hear those questions.
Yes, sir. We have received few questions, and first question I would like to put on forward. Mr. Hassan Singh is asking, it's a very common question we generally come across. Is medicinal management like fat burners, hunger depressants, good for health? And second connected question is, what about HCG injections people are using for a fat loss? Is it safe? Dr. Shweta, you have already covered, but I would again request you to put it.
Thank you. I think we should not take any shortcuts. Again, my message is there are experts, and there is one more question related to whom should we go to obesity treatment for. So either you can go to an endocrinologist, you can go to a medicine specialist who is specializing in obesity. We do have both the facilities available at Rath Hospital. So you have to go to the professional expert, or you can take the lifestyle route, which Professor is the expert about. You cannot do it on your own. Yes, there are a lot of ton of things which are available, ton of things which are advertised. It's a big problem. So it's a lot of things are already up there, fat burner stuffs, and then there are some coffees, there are some teas, so many things which are related to some injectable agents that you mentioned. But would you want to experiment with it? I would say absolutely no. Just take a proper professional guidance, and then yes, everything will fall in place. We all have the tendency, right? We just go to Google, anything which happens there, and okay, there's a keto diet, there's keto coffee where you put a ton of butter inside the coffee, and then yeah, I don't say none of that is wrong, but I also say that every person is unique in their own make. There is a metabolic profile associated with each person, and let's leave the experts to their job to decide what's right for you.
Yeah, true. Every individual is a unique identity itself, so they should be going. Now, one more question which we have received. Actually, you have already covered who should look for a medical treatment. His person, Mr. Bharat, is asking who should consider for going a medical management for obesity. What are the things we should consider and we should discuss with the doctor?
Yes, so all the people who are more than 30 kg per meter square, which means obese, or morbidly obese, which means more than 35 kg per meter square, which means you're really big, 120 kilos and above, 150, 160, we do see 170, 80 kilos in our clinical practice. If you have diabetes, which is not being treated well with your medications, you have high blood pressure, which you are not able to treat it, you have had a heart attack in the past, you are at high risk for developing the paralytic stroke, you are already having some chronic issues in the skin or liver, which is not being treated well, you cannot sleep properly, your sleep is not refreshed, or OSA that I mentioned, any of the two or more related complications from your weight directly related, which means you have to medically treat yourself. And obviously the joints and the spine and so many other things are there. We do see, being a neurologist and spine and brain, I do see a lot of spondylitis recurring, which means the patient's back pain is never cured because of the excess weight that is carried by the lower back. Those are the conditions where you will have to medically reduce the fat so that the person can get back that health. Yes, so those are the
that will help to maintain the posture also.
Yes.
Yeah, ma'am, there is one more question, very interesting. Sapna Joshi is asking, I am pre-diabetic and my morning sugars are between 115 to 130. My HbA1c is 6.5. Should I take metformin? Will it help to reduce weight and maintain the sugar levels?
Sapna, thank you for this question. I'm not a diabetologist or a medicine person, but I'll give you a very generic answer to this. As I said, every single patient is different. So you as a patient profile is very different. So many other things have to be taken into account. Your kidney status, your liver status, your family history, your lifestyle, your diet patterns, etc. and stuff. So it's never one fix, one rule kind of the thing. You have to tailor make it to the individual requirements. But pre-diabetes, let me talk a couple of lines about it. Pre-diabetes is very common. Pre-diabetes, which means you're not fully diabetic, 126 and above in fasting, or you're not above the diabetic range of 6.2 or 6.3. I think they keep on moving the ranges. So if you're not above that, but if you are at the middle somewhere, in terms of HbA1c. So HbA1c is nothing but a video record, so to speak, of your 3 months, and snapshot, what she's indicating is the fasting sugar between 115 to 130. So 100 is your cutoff. Beyond 100 and 126, if you fall anywhere, which means you have pre-diabetes. Okay. Now, if it is going between 130, possibly you are already a diabetic. So this is what you have to discuss with your diabetologist. Metformin is a very simple medication. There's no harm in taking it. Metformin has a lot of other vascular protective role also, which means it protects your heart, it protects your kidney, it protects your sugar. So it also has a role to not let you progress from pre-diabetes to diabetes, but there's no magic into it. You have to follow all the lifestyle stuff along with it. You have to complement it with medicine. It's like very interesting thing, okay, now a person is taking insulin and then he gets the license or the passport to just take all the kind of unhealthy stuff. It never happens like that. Just saying that, no, insulin will take care of it. No, insulin also has its own complications when it comes to the treatment, unless it's not type 1, which is different story. So you cannot justify that I will eat this and then I'll do this also. It never happens like that. Professor is smiling. I'm sure he has more to contribute to that in terms of lifestyle.
No, not really. But I do notice on my screen, I have one of our participants, NB, who is nibbling at something. And I'm very curious to know what that is. If you can unmute yourself, NB. Oh, well, don't worry. We may not be able to unmute you at this time, but if you can let us know in the chat what it is you're nibbling, it would be very interesting to fall in line with what Dr. Shweta said. You're working and you're constantly eating. That was a correlation, and therefore I noticed it in you and I was smiling. I'm sorry for making a personal analogy. Yes.
No, but I think the interaction is what keeps us alive, right? So thank you for keeping all the videos on, because then, we are not talking to a wall. Otherwise, it's like just a wall that we are speaking to. So first of all, thank you for that. It's okay, he can eat it for this time. But coming back to the question in relation to the HbA1c, I think there's a follow-through question, Dr. Wilku.
Yeah.
There is Mohammed is asking, can you...
Yeah, I'm facing a lot of issues like constipation since I have stopped taking much of carbohydrate. Please advise. I think the dietitian will be the best person to answer. But still, ma'am, you can put your...
there, right? We have two diet-related topics coming up in the next...
yeah, next will be the dietitian will be talking about the popular diets and the myths about that. Ma'am, one question. Sorry. One person is asking, I have expert says running every time is running for a weight loss damages the cartilage. Running 6 weeks a day. Please answer this.
Yeah, so see, again, you cannot suddenly start running. The one fine day you get realization, I have to go thin and I start running. It doesn't happen like that. There is a stress involved in running, in jogging, in brisk walking to your joints. So you have to gradually graduate it and then slowly acclimatize yourself and then have a proper training program. So everything has to be done properly. Again, how old are you? What is your weight? What is your otherwise normal routine, etc. All this comes into play. So again, it's a personalized sort of a thing which you have to do it for yourself. So understanding all that, you have to work. Now, some people have already got back issues and then they start running, or they have got joint issues. So you can actually damage your joint more than you can do service. Same thing happens when you're climbing stairs. A lot of people you might have heard that it's best to take the stairs and don't take the lift and all that. But provided that your joints are healthy, provided that you're not too overweight, that you're not stressing your joint. So everything has to be done in moderation, considering your genetic, metabolic, physiological profile. And that is the reason why we are having this whole circus of events, because it is just so that you don't do anything which is half-hearted, anything which is just off the shelf from Google and then experimenting with it. And because then the broken things takes a long time to fix.
Yes, ma'am.
Absolutely. Dr. Abhi, just a rule of thumb to add to what Dr. Shweta says, and that is that if you are overweight and would like to lose weight, it would certainly be damaging if you try to jog. Okay, you are overweight, you are already loading all the joints in the body, you will hurt yourself. So we normally recommend walking as the best form of exercise for individuals who are overweight. It has the least impact on the joints. So walking is better than jogging when it comes to losing weight from the structural perspective, as Dr. Shweta pointed out.
And I think an early morning walk was always highlighted, and that's just because you have some sunlight, you have some vitamin D, and then there's fresh air, oxygen, there's less of pollution. So there are all these, because a lot of people, when it's very interesting to sit in the clinic, you know, when you prescribe walking, they may say, oh, what is the time of the walking? Is it good in the evening and is it good in the morning? But these are some of the generic things that it's always good to take a stroll in the morning, a walk, a relatively brisker walk if you are prescribed to do so, but a normal walking is good enough. There's no need for anything which is fancy at all, unless you are training to be an athlete, a marathon runner or something. That's a completely different story. We're not talking about those.
Right. The best way I would like to add, then, if you really want to have a obesity management, first you should go for an assessment by your doctor. Once the assessment is done, then the plan and protocols will be made to have a successful weight loss without any side effects. Like ma'am, you were saying, Mr. Mohammed is asking, my HbA1c is 7.5 and fasting sugar was 173. When I weighed, it was 116 kgs. Now HbA1c is around 6 and fasting sugar is in between 110 to 18, 19 and weight is 101. Good. Does this mean the diabetes is reversible? By the way, I did not take any diabetic medications. Yes,
Very
of
good.
course, ma'am, you should be.
Thank you, Mohammed, for this point. This very well, exactly picture perfect message that losing 15 kilos already reduced the sugar from 173 to 119. So you became from diabetic to pre-diabetic. So you sort of, reduced your this to it. Now, taking the medication or not is again the endocrinologist's purview, because as I said, there are other pleiotropic effects or vasculoprotective effects of the medication. So it's not just that medication is required. Plus, what happens is a lot of people, let me talk about this, maybe the dietitian will further talk. A lot of my own colleagues and my own relatives talk about this, that I don't take sugar. Now, why do I need to take the diabetes medication? It is not just what you are taking in or ingesting. It is also your metabolic profile, your gene, your insulin secretion, your pancreas capacity, so many things, your glycogen to glucose conversion at the muscle, the resistance at the muscle, so many factors are involved. So saying that because I'm reducing the sugar, because now I'm doing this, I will stop the diabetes medications. That's a very wrong thing to do as well. So best is go to your diabetologist and then discuss it. That's the best advice what I could say. But one very important take home point is reducing 15 kgs made this difference. I would say that, Mr. Adnan, if you just go, I don't know your height, there are some prescribed standards, but another 15 kilos would possibly do a magic. There's nothing called reversibility. Once you have it, which means you are already some metabolism errors are there, then you have to continuously check it. So every 6 months, get a check done. So it's like taking your car, if you have a battery issue every some months, to just make sure that everything is right.
Yes,
but each person, each metabolic profile, each physiology, each genetic factors, everybody is different.
Yeah, true. We have sent the first health tip, which has a complete height and weight chart, and for a male and female category both. So please just follow that, and how much overweight you are, so you will be having a rough idea, and accordingly you can work on it. There is one interesting question, a very short question. Is losing a lot of weight in short time is fine? You have already answered. A short 10 minutes walk will help you to have good hormones in a boost, so that it helps to maintain your depression and other things. But how it is going to benefit the weight loss, ma'am?
Again, it depends on your medical problems. If you have a plethora of medical problems, you just had a heart attack, you are imminently due for having a paralytic stroke, you have joints which are just terrified because of the severe obesity, your back is bad, and then we are going for medical reduction of the obesity, then yes, in that case, 60-70 kgs that you lose is fine. But then you are observed. It's sort of, in an environment where somebody is monitoring you, because you can have a lot of nutrition loss, you can have a lot of important vitamins and minerals which you can lose, etc. And also a dedicated, observed sort of a thing, monitored is fine. But otherwise, just experimenting it and suddenly reducing, you will have a yo-yo phenomena. So you can again get back to that weight what you were. So you should never do it on your own.
There is one interesting question. We generally come across this many times. One person is asking, liposuction is very commonly advised in a fat loss. Generally, the cosmetic parlors do this. And what is the difference? Who should think to do liposuction?
See, there are many, many such things. There is also fat iron. There is also cold cryotherapy, cryosculpting. There is liposuction. There are some creams. There is ultrasound. Many, many, many things are offered. But again, I would say that there is literally no shortcut, because you have to understand the physiology behind it. Cosmetically reducing a little weight, which is around your belly or around your this, is not going us and leading us anywhere. Because if you have never understood how your body's metabolism is, your lifestyle is, you will again get back that fat in no period of time. Plus, sometimes the anesthesia complications, sometimes the procedure itself, you're actually drawing the fat out, there can be an infection inside it. So all this is possible. Possibly the best advice for me at this stage for those people who are considering that is, please take the expert's help. Don't experiment.
Yeah, thank you, ma'am. Ma'am, most of the questions we have answered, and
there is one more which I'm seeing by Asha, saying that EMS training is effective for healthcare and weight control. I do exercise 45 minutes daily for 5 days.
Yeah, I was going
Very
to that.
good.
Yeah, please.
I think 45 minutes, I wish I could do that, Asha. I mean, there's always this bar which we have to keep it high, but 45 minutes is very good, 5 days. I think the prescribed activities is 10,000 steps a day or 175 minutes. Is that correct, Professor? 175 minutes in a week, which one has to do some sort of moderate activity. EMS is interesting. Let me talk about that. It's electrical muscle stimulation. So you have some patches which you apply. There is a little wire which connects to a monitor. And then there is a little bit of an electrical stimulation which happens as you are working out. So that is sort of the new fad, or so to speak, the new industry EMS which has come out for weight loss. There's no harm per se, again. But the whole idea is, for example, if I ask you to drink a particular type of the water, okay, let's say I'm asking you to drink some ABC type of water. End of the day, I'm just hydrating you. That ABC is just a fancy name associated with it. In the same way, EMS, end of the day, I'm just making you move. You're moving your body, which is the most important component, rather than that EMS helping you. It will have a little bit of a placebo effect. It has its own science. I don't say no to that, but end of the day, moving is the key to everything.
Right, ma'am. Ma'am, the last question which I will request you to answer, because this is a takeaway message. What do you suggest for a weight loss as a medical professional? Lifestyle modification or a medical management?
It's a balance. It's both, and it's and I would say and this, because one alone medical is not enough, because you will regain the weight if you don't do your lifestyle properly. If you have only lifestyle, possibly if you are at a certain stage when you are not getting enough help from the lifestyle, it won't work. So it's a fine balance between the two which you will have to adopt. There's no, again, literally there's no shortcut when it comes to obesity management. There's also this very nice question, and that's very dear to my heart, which is, we should have dinner after 6 p.m. is bad. And thank you for raising that. I personally, so there's something what I follow is, after the sunset, I don't take anything. So yes, there's also something called intermittent fasting, which means after 6 o'clock, if you don't take anything until the next day morning, it is very healthy for your body. Why is it healthy? Because you are giving enough rest to your system. You're allowing the cells to regenerate. You are allowing all the necessary metabolic processes. It's like a factory. Imagine the body as a factory, your whole metabolism as all the processes happening. You have to ask your guys to take some rest, right? You cannot have the factory running all the time. That is essentially why after 6 p.m. and I've been practicing this for many, many years. I got this lifestyle, thankfully, from one of the naturopathy institute that I visited. And a lot of people say, oh, being an allopathic doctor, going to a naturopathy institute, I think it should be a balance of both. So naturopathy is nothing but a lifestyle, and 6 p.m. eating after that, not eating after that, is also a lifestyle. A little bit of milk. Some people take some fruits, which is fine, but anything heavy, anything dinner, that should be completed so that your it's processed, your all the glucose, etc. and stuff is done, and next day morning you can have your regular rhythm again. So thank you for that question.
Yeah, ma'am. Thank you so much. Professor, I will request you to answer this question. Mr. Mohammed is asking, he's wondering about it. Why rack management has taken a step of running this weight loss challenge? You are not gaining anything. And is it a corporate social responsibility? Professor, you will be the best person to answer this.
The reason why RAC Hospital, the reason why RAC Hospital is undertaking this weight loss program is clearly a matter of social responsibility, a deep understanding of the needs of our population. We are a fear that our population is using a lot of misguided methods to lose weight. And therefore we embarked upon this through the insight of our own CEO, Dr. Raza Siddiqui, that we should do a service of love to the population surrounding us. And our own RAC hospitals population also has a high obesity ratio, surprisingly. So we thought to ourselves that we must undertake this activity.
And
We
Professor,
did it
if I
on a
may add
previous
one,
occasion, we're doing it now again. Yes, Dr. Shweta.
Professor, if I may add again, also, I think to all the people, and I keep telling this to all my patients, this analogy, what do you think is the meaning of the word doctor? Some of you can put it in the chat, but the most answer that I receive is to treat. Unfortunately, the meaning of the word doctor is not to treat. It is to dossier, which means to teach. So fundamentally, the most important thing in life for us as doctors is please don't fall sick so that we don't have to fix you. So do things so that you fix yourself. Essentially, no hospital or no healthcare institution, and we are just not a hospital, we are a healthcare institution integrated with wellness. Professor works with wellness, and then we have our medical teams associated. It's an integrated care with which we have to work for, not just for ourselves, our community, our nation, our world, and planet at large.
Thank you, ma'am. Professor, I think we have already covered all questions, but one last question I would take. Sapna is asking, again, ma'am, it was connected to the same question. Having dinner after 6 p.m., like you said, it's better not to take it. And what about pre-diabetic and diabetic patient, because their sugar levels fluctuate?
Yes, that is why individualization is so important. Thank you for bringing that. So the intermittent fasting and the dinner thing is only for normal people with normal this. So otherwise, if you are diabetic, if you are taking some medications, please talk to your doctor.
Yeah, thank you, ma'am. Professor, over to you.
Yes, and Dr. Shweta said it all, especially in her last sentence where she explained that the meaning of doctor, or the objective of doctors, of course, was to treat, but more importantly, to educate. And this question and answer session, Dr. Wilku, thank you for that, has given us so much of education. Dr. Shweta spoke about liposuction, and I thank you for that answer. We spoke about high impact activity, whether it is essential or beneficial to our individuals who are weight loss, and we decided that perhaps we should look at low-level activity like walking. Dr. Shweta spoke about intermittent fasting and eating after 6 p.m. As not being the best, as eating after 6 p.m. as not being the best practice. And yes, I certainly agree with her on that. She also answered the very tricky question about, does an individual who is obese resort to medical management, or should lifestyle do? And she very correctly, very aptly, and very appropriately said, well, you need everything. But first of all, you need to consult your doctor, who will advise you. Please do not think of solutions by yourself. Very, very educative as always. Thank you so much, Dr. Shweta. And also, Dr. Wilku, now that you've asked me to give a little vote of thanks, I would like to thank you. I would like to thank Dr. Shweta, which I have done. I would like to thank you, Dr. Wilku, for putting this entire seminar, webinar together. I would like to thank all our employees behind the scene. I know that we have Arabian Wellness out there. I know we have medical services supporting us. I know we have our computer division supporting us. I would love to thank most of all our audience. for coming in and spending a bit of your Sunday with us over here. Thank you so much. On the screen is our next webinar. It will be addressed by our Chief of Dietetics in RAC Hospital, Miss Ruba, and we will be talking about all aspects of the diet. I want to thank you all. Thank you so much for participating in this webinar, and we look forward to having all of you with us again tomorrow. Thank you so much and have a great day.
Thank you, sir. Thank you, Doc.
Hi, Professor.
Thank you.
Thank you, sir. Thank you, madam.
Thank you very much. Thank you.
Doctors. Thank you very much.
Thank you so much.
Very much. Thank you.